Good afternoon, everybody. Thank you for attending. Little bit attendance. So before we move to the main agenda, I'll quickly confirm the names of the members who sent their apologies. We have John Wilson, Simon Barton, Chief Superintendent Jonathan Starbuck with Barney Thorpe, Dr. James Ogle, John Sinnott, Ed de Clubley and Raksha Varma. Item 1, minutes. I propose that the minutes of the meeting 26th May are taken as read, confirmed and signed. Item 2, urgent items, done. Item 3, declarations of item 4, we have my position statement emailed to you, and a version is also published on the Council's website. My position statement begins with an update concerning local service pressures. So references the development of the integrated care strategy, engagement events I have attended as a member for health, and the work being undertaken to support in the cost of living crisis. I have also mentioned my concerns over the emotional and mental health, especially the children. Does anyone have any questions? Item 5 on the agenda is a progress report on health and wellbeing plans, pages 9 to 4. This report provides the board an update on the progress of the 7 community health and wellbeing plans across the and Joe Clinton, the ICB's Head of Strategy and Planning, has joined virtually to present this report. Thank you, Joe.
Thank you. Good afternoon, everyone. So I will take the paper as read. The front end of the paper is pretty much just a reminder about the purpose and governance arrangements of the plan. But just as a reminder, these plans are there to support the integration of health and social care. They're also a vehicle to respond to the housing growth across the county, because we know there's significant housing growth, and also about looking to reduce health inequalities. So it really has been a true partnership, and they're being driven through the integrated neighbourhood teams with obviously our district colleagues and public health colleagues. So really positive partnership and collaboration. So in terms of the specifics of the plans, the Charnwood, Hinckley and Bosworth and Melton plans are currently at the priority setting and delivery plan stage, and they'll be due to take their plans through governance early next year, with a view for the plans to go live from the 1st of April. So that's really positive. The Blaby and North West Leicestershire are holding their priorities workshops this month, so slightly behind those 3, but we envisage that they'll also go live April-May time. And then there's 2 that we've not started, so that's Oadby and Wigston and the Harborough plans, and we're due to start them March-April time. So we've already seen a few emerging themes that have come through from the plans, and in particular around children and young people and mental health and wellbeing. SEND provision in education has come through quite strongly in a few of them, and also around carers and needing to improve services for carers, and of course the cost of living as well is a reoccurring theme in them. So I'll stop there. I'm happy to take questions, Chair.
Thank you.
Yeah, cheers, thanks, Joe. I suppose is it such when you say one of the core themes kind of talk about the ability, no, that's a big say a bit more about that in terms of there's not enough of it, or this is what we want.
So Mark, I'm really sorry, you keep coming in and out, so I don't know if I've heard the full question. I think I have. So what we're finding is that we're getting a lot of feedback about the amount of time that children are waiting for their SEND assessments in education, and that's having an impact on their learning. So that's one of the things that have been coming through, so that we need to be able to feed that back into our learning disability collaborative as well. And obviously through the Education Authority. I think that's the question. Apologies.
Cheers. Thanks, Joe.
Do need the link up. Anyone else? Okay.
Sorry, yeah, just to come back on that, yeah, the SEND system, local area response, understand where we would want to raise that, because it's not an education. So there is currently today across special education. It's an issue that the local area and have a action plan as well. So I didn't know if it was flagging up any concerns that were already.
I'm really sorry. The sound keeps coming in and out, so I'm not quite sure what the question was. I think it was about where we raise it in the right place to raise that.
That was just Jane saying whether over and above the plans that we already have in place for the high amount waiting for the SEND assessment. I paraphrase that okay? Yes. I think what's needed is an understanding really of what the authorities are doing in this regard, rather than doing something separately. So
yeah,
it's need us to plug into that. Thank you. Sorry? Oh, Andy's going to come in. Thank you.
Yeah, thank you. Not on this point, but just a general point about the importance of this work, really, because I think one of the key challenges and opportunities we've got over the coming year is to think about how we genuinely achieve an integration of service delivery, not just planning. This work is the foundation of that, because this is us planning together, but I think it lays the foundation for us to do some really great work creating integrated teams. The services that the county provides, the services district provides, services the NHS provide, and the very considerable resources in the communities themselves, actually, the voluntary and informal carer sector. So I think, although today we're having an update on the planning, I just wanted to kind of lodge in our collective minds, if you like, that these groupings, I think, are a really good foundation for integration going forward. And I think it's going to be really exciting to see how they develop. So hope we can see that some more in the new year.
Thank you, Andy. I think the issue at the moment is that it seems to almost be taking that line of taking everything in. And I think we've got to respect that the council does an awful lot of work with children and families, well, in every area, and so we don't want things missing or dropping down the gaps or duplicated. Sarah.
Yeah, I think on the point that Joe was making around SEND, that's not necessarily an answer for the community plan, but it's to make sure that when those things come up, we feed them back in to the relevant authorities, I think.
Okay,
just for assurance.
Yeah,
it's not going to cover everything.
That's great. Anyone else? Thank you. So we're asked to note the work being undertaken to develop the 7 community health and wellbeing plans. So we're happy to note that. Thank you. We now move on to item 6, which is the Joint Strategic Needs Assessment, End of Life, pages 15 to 22. And this report provides the Health and Wellbeing Board with a summary of the recommendations that have arisen from the recently completed JSNA End of Life chapter, and also details of the ongoing work to progress the other JSNA chapters. Dr. Sean McGill, who now works for NHS England, having previously worked as a public health consultant for the County Council, will present the report along with Andrew Turvey, who is a public health consultant within public health.
Thank you, Chair. And I'll just say, I'm sorry, apologies if it was put down that as a consultant. I was a registrar in public health, working with the council at the time, working at the time with Viv Robbins before she left, and then Andrew Turvey is the acting up consultant now. Thank you. But thank you very much for having me, Chair. So we've undertaken a joint strategic needs assessment chapter on end of life, which seeks to provide an overview of the data on the care and support for those who are themselves at this stage of life, their loved ones, and also those who work in the area. It was done by collecting information from multiple sources, including local organisations and services, national data sets, a literature review and locally commissioned reports. We also undertook an online survey to better understand the lived experiences of local people, which I shall discuss shortly. So we followed the standard JSNA format, starting with consideration of which populations are at highest risk of negative outcomes, followed by a look at the level of need in Leicestershire. So across England, we can see nearly 42% of deaths occur in hospitals, despite only 3% of people saying this is their preferred place of death. In Leicestershire, this figure stands at 39.7, which is significantly lower than that national value.
Chair, I haven't got.
I was going to ask for them to be circulated. I don't think we've had them. So, no, we'll circulate them afterwards.
I'm not very good with the computer, and I just thought I'd missed
No,
it.
I was going to ask Matt in a minute, but yeah, you've done it.
No problem, thank you. In Leicestershire, then, we have an additional 30% of deaths occur at home, and around a quarter of deaths then occur in care homes. It's important to note, though, that for many people, their usual place of residence will be a care home, and so the distinction between home and care home is sometimes a bit blurred there. Finally, we then have 3.5% of deaths occurring in hospices, which is significantly lower than that of the national value. If I could have the next slide, please. So the survey we undertook sought to collect the views of bereaved individuals on the care their loved ones received towards the end of life, the bereavement support they themselves received, and also the experiences of those of informal carers and paid staff. We had a total of 73 responses, 26 of whom had recently been bereaved, 22 were informal carers, and 36 were paid staff working in end-of-life care. Some of the most striking results are highlighted on this slide here. A common theme that arose was that people were often unaware of the services available to them, and when they were aware, found them difficult and complicated to access. Informal carers also highlighted that they felt often they were unsupported in training of how to care for someone near the end of life, with 86% feeling they didn't receive enough support in that area. The next slide, please. So, furthermore, informal carers told us that the burden of trying to navigate this complicated system often falls to them. And here are just some quotes that we received. We had some quite powerful stories from individuals. The top one, for example, they said, "We were left to our own devices to deliver the care, regardless of the fact not one of us was medically trained or even had any idea how to safely help move and transport our family member. We didn't know what to expect and found the lack of support very distressing." So had some really powerful stories and really useful information from local people. Next slide, please. So we collated our findings to identify the unmet needs and gaps locally. These included the need to support people in having conversations about end-of-life care so that they're more likely to be realised, that there's a lack of coordination between services, as we've mentioned, with it also being unclear to residents what is available and how to access them, that there are limited community out-of-hours services, which produces a barrier for people staying at home and receiving care at home if that is their preferred place of care, and that informal carers and staff do not always feel they receive sufficient support. Slide. Thank you. So in order to address these gaps, we've identified a number of possible recommendations. Firstly, we recognise the need to explore some of the highlighted areas further. This includes by undertaking a tailored piece of engagement with people who are themselves at the end of life, so we can get their views directly. And also undertaking a health equity audit, so we can further explore how certain disadvantaged groups can be differently affected by end-of-life care outcomes. Slide, please. To support conversations around end-of-life preferences, we then recommend seeking to promote conversations at major life events using a Making Every Contact Count Plus approach, and exploring how behaviour change theory and social marketing techniques can be used to increase and improve the acceptability of having these difficult conversations. We also recommend encouraging healthcare staff to initiate these conversations at an earlier time point when interacting with patients, so that patients can contribute most meaningfully to these before any deterioration in their health and well-being. Next slide, please. Whilst we have a lot of services and people were telling us how good those services were once they interacted with them, we identified that people are often unaware that they exist. We would therefore recommend local campaigns and resources to help people increase the public's awareness of these and their understanding of end of life. Dying Matters already provides a really great resource, bringing a lot of these things together, so we recommend working with them to build on that further, rather than risking unnecessary duplication. Next slide, please. Regarding services directly, we recommend developing a more robust community out-of-hours offer. Local people were telling us that there's often a challenge here, and it means that they have to be admitted to hospital and they're unable to continue the care at home, even if that's their preferred location. We also identified the need for a dedicated paediatric palliative care consultant to support end-of-life care for younger people. Next slide, please. And our final set of recommendations relate to supporting carers and staff specifically. This includes through providing additional support for informal carers to take respite care, providing additional training, and also considering how regular check-ins with informal carers can take place so that they don't feel so isolated and alone during these difficult times. And then the last slide, please. So the JSNA has now been completed and uploaded onto the County Council website, where it is available to view in full. And the next steps for this work currently, the Integrated Care Board are in the process of putting together an end-of-life strategy for LLR, and feeding into this will be the Leicestershire JSNA chapter, the Rutland and Leicester City chapters. These have all shown quite a high degree of similarity in their findings, so it'll be interesting to see what that strategy shows when they develop it. Thank you very much, and I'm happy to take any questions.
Thank you. Are there any questions on the paper? Yes, Mike's in.
Yeah, thank you, Chair. And thank you, Sean. I just want to say thanks for a great presentation. I was going to say generally, I think the JSNA chapters have really come on, and I like the idea we're getting some sort of specific recommendations. So it's a thanks. I was going to ask you about next steps, but I think you covered that with the ICB. But I don't know if Andy, Sarah, do you know the dates when the strategy would be? Yes, but it might just be nice to sort of note rather than just say it will go to a meeting, that there's a bit of a timescale for considering and taking. Cheers, Sarah.
As I understand it, there's unfortunately been a bit of sickness, so their meeting has been delayed, but they're hoping to meet in the new year to create a more definitive timeline of when this strategy would be developed.
Thank you. I think it's a really important piece of work, to be perfectly honest. Anybody else? Any comments? So the board are asked to support the recommendations of the Joint Strategic Needs Assessment End of Life chapter, noting that the PACE priority actions will be delivered through the Joint Health and Wellbeing Strategy Delivery Plan and system actions via the Leicestershire and Rutland End of Life Strategy, and also to note the timetable for the development of the remaining chapters identified in the current JSNA cycle, and comment of the list of proposed future chapters, identifying any additional chapters required or particular priorities among the current list. Are we all happy with that? Yes, thank you. Item 7 is a report on the partnership approach to tackling health inequalities in cancer screening, pages 23 to 34. Our next report provides an update on a project led by Leicestershire County Council's Public Health team, which explored the perceptions, experiences and influences to attending cancer screening in communities with poor screening uptake. Bharathi Kumaravel, a consultant within the Public Health team, has joined us virtually to present this report. Thank you, Bharathi.
Thank you very much, Chair. So as the Chair mentioned, I'm Bharti Kumaravel, Consultant Public Health. Since we were coming out of COVID, end of last year, we started working very closely with our primary care network colleagues to identify what are the challenges they were facing because of inequalities, and they all submitted the inequalities plan, and we were reviewing them and providing them guidance on identifying priorities and working in partnership with key stakeholders to address those inequalities. And of all the PCNs, Carillon PCN, the clinical director, Dr. Leslie Borrell and Dr. Anu Rao from Beacon PCN, they both came forward and they specifically sought our guidance on addressing priorities and triangulating data from available intelligence sources. So Kajal Ladd, our strategic lead for healthcare public health, so she looked at all the intelligence available for cancer screening, immunization, health checks, and COVID vaccinations. We identified some practices which were in bigger need for some support. And the PCNs were really keen to take on a collaborative approach and working with us and with the communities. So Holly Hutchinson, our strategic lead for health improvement, and her team, we together identified some communities which were, specifically affected by this inequality. So the Bangladeshi communities, the Polish communities, and homeless and sex workers and Gypsy and Roma travelers. They carried out some focus groups with them. They also carried out some surveys with our frontline staff. And based on these perceptions, our junior doctors who are under training with us, they also carried out some literature reviews to find out what were the challenges in these communities accessing our service. Triangulating the data, and based on what literature said, we made some recommendations, and the PCNs were really proactive. They took on an action research approach. They said, okay, this is what our public are saying. Let's provide our services in response to their queries. And they started providing outreach services on weekends and evenings to provide cancer screening, specifically bowel cancer screening and cervical screening. And they were keen to work with us to engage with these communities. So we have recorded some podcasts as well to encourage communities to come forward as a way of raising awareness with them. As a next step, in addition to the cancer screening, they have also started offering outreach clinics for asthma, especially around winter. And it's been well received, and it's in the community setting. And now we're building it further, taking it to the UHL, and UHL colleagues are keen to come out into the community because UHL and LPT have also observed variation in access to their care. So they're very keen to work with public health, with our communities, co-creating a health service pathway, which can address inequalities. So this is the work to date. We just wanted to bring it to the attention of our Health and Wellbeing Board members, and I'm very happy to take on any questions. The next step is we are taking it not just in Sharnwood, because the lessons we have learned in Sharnwood could be applied across LLR. So we are going to share them with other primary care network clinical directors. We are also sharing it with GPs in educational events, and so that they can learn from our experience, and it's been shared regionally and nationally as well. And everyone is really keen to learn about our approach, co-creating along with our communities. So I'm happy to take any questions on that.
Thank you, Bharathi. It's really nice to see the progress, and I look forward to it being rolled out, especially the now you're going on to the respiratory project as well. Does anyone else have any questions or comments to make? No? So the work undertaken to explore the reasoning behind the declining cancer screening rates across GP practices in PCN areas in Charnwood is being noted, and the recommendations set out in the report to increase cancer screening uptake and reduce health inequalities in Charnwood should be approved. Are we all happy to do that? Yes? Thank you.
Thank you, Chair.
Thank you, Bhavati. Item 8 is the Joint Health and Wellbeing Board Strategy Update, which is pages 35 to 112. This report provides the Health and Wellbeing Board with an update on the progress made in the initial stages of delivering the strategy. We're going to move over to Joshna Mavji, Assistant Director of Commissioning within Public Health, who will present the report. And can I take this opportunity to formally introduce and welcome Joshna, who will be adding the Health and Wellbeing Board to her portfolio. Thank you, Joshna.
Thank you, Chair. So the purpose of the report is to provide an update to members of the board on the progress of the Leicestershire Joint Health and Wellbeing Strategy since it was approved in February early this year. The background for those of you that aren't aware, the strategy is based on a life course approach with 3 subgroups at the moment sitting under the board that deliver the different elements of it. So we've got the Best Start for Life captured by the Children and Family Partnership Board, the Staying Healthy, Safe and Well element being captured through the Staying Healthy Partnership Board group, and the Living and Supported Well and Dying Well elements being picked up through the Integration Executive. Within the strategy, we've got a set of those priorities under each of the life course, alongside several commitments. Since the board meeting in May, there's been lots of development sessions held by the subgroups to look at the commitments within the delivery, within the strategy, highlight several of the key priorities that we want to take forward within each of those, which will become the spotlight areas of focus. Within those development sessions, there were several cross-cutting themes identified, specifically around mental health, health equity, the impact of the cost of living crisis, and also about establishing good relationships and strong partnership working. There was also a strong emphasis on the change in cultures and behaviours and taking more of an alliance approach across the partnership if we're wanting to make a difference in this arena. Significant progress has been made by each of the subgroups, and this has been at varying stages. So within the report, there is more of a detailed summary on the progress of each of the 3 subgroups. Just moving on to, there will be an item further down in this meeting around establishing a 4th subgroup focusing on mental health, but I just wanted to sort of highlight that as part of this update. In terms of performance reporting, previously this board approved for progress against the outcomes to be monitored quarterly. The indicators that have been developed have come from Fingertips, which is a large health and wellbeing data collection source. And the majority of these indicators are updated on an annual basis. So for the majority of these, if they're presented quarterly, they're unlikely to change. And if we're not going to see the significant change, there is a risk that we're presenting quarterly dashboards with very little in terms of update. So as a result, we're proposing that we change the frequency of outcomes reporting from quarterly to annually. And what this will allow is a deep dive within the specific areas that have shown a specific change, whether that's positive, whether that's a downward trend. We're also looking to scope having additional indicators to provide a more richer evidence base, which we're looking to explore next year. The intention is that we'll still do quarterly monitoring in the background, and so if there are any significant changes, we will report these to the board by exception. So we're not sort of saying we'll move to annually and not do anything else in between. With regards to an update on the subgroups as well, we're proposing a similar format for the work and the updates provided by the subgroups. At the moment, the agreement is for each of the subgroups to provide an update on progress every quarter. At the development sessions, there was some feedback that felt like it was too frequent, particularly when the priorities are being established. It's almost about proving that the outcomes are being achieved. And I think to provide that quarterly would have been quite challenging. So there has been some feedback that that quarterly was too often and that the reporting was likely to become monotonous. So once the priorities have been agreed and there are spotlight areas that have been agreed by each of the subgroups, the proposal that we're putting forward is to have a minimum requirement for the subgroups to provide an annual update, but if they wish to come more frequently, they're able to do so they can set their own frequency of work in the interim. And the intention is that when that update is provided to the board, that the subgroups will provide a deep dive analysis. So we'll get much more useful information, focusing on the indicators and focusing on the progress. That will also then enable, if we rotate it so that each of the subgroups present at least on an annual basis, it means that we get that deep dive, but also the board will have a regular update at its quarterly meetings. And there is a suggested timetable within the report. In terms of communication and engagement, as you'll be aware, the board approved a communication engagement strategy at its February meeting. In terms of progress, a design document for the strategy has been developed by our design team. We've also created a plan on a page version of the strategy. These have all been attached. Further work to scope out the redesign of the website for the board is currently underway, and we'll look to do more of that next year. And that's going to include promotion of the strategy as well as developing an easy read document. A short video to promote the work of the board, including providing a brief outline of the objectives, is also currently being developed, and that will be for the public. So the purpose of that is to provide insight into the work that we're doing, but also around the wider partnership. And we're hoping that this will be the icebreaker that we need to encourage the greater opportunities for that dialogue between the public and this board. In terms of next steps, I've mentioned some of the work around the communication engagement and development of the priorities within the subgroups. Other developments, and we're looking to do an evaluation of the strategy as part of the yearly annual report, which will be presented to the board next year. The purpose of this is to highlight any progress that we've made to date and any areas that require further development. Part of this evaluation work, we're hoping to also look specifically at culture and effectiveness of the board. So again, what we're suggesting is for members will be invited to answer some survey questions anonymously, with the view that we're seeking your views and perspectives on how you think the board is developing and also any future areas for development. And that's it from me. Happy to take any questions.
Thank you, Joshua. A lot of work going on there with all the subgroups. Very important, but it is a change of mindset in a lot of ways right across the work we're doing. Does anyone have any questions? Mike?
Yeah, thanks, Chair. Me again. So, yeah, thanks, Josh. That makes perfect sense to me. I think overall what you've described there is a kind of more flexible approach to the reporting. So instead of being kind of rigidly stuck to that kind of plan, do, sponsor, watch and the quarterly updates and sticking with the outcomes, those conversations about what works for the subgroups, I think, are kind of useful. Also agree with the points you made about kind of some of the development sessions and getting the culture right and everything like that. The one question I was going to pose was, at some stage, we're going to have to look a bit more in depth at the outcomes, because that summary dashboard has got an awful lot of indicators on it of varying colours. Now, we can't make sense of that quarterly, but on an annual basis, I'm thinking if we ever sat down and worked out as a board, how do we look over the outcomes, not so much in terms of progress on the comments, but actually looking at the health of Leicestershire as per that dashboard, and then putting some effort of the Health and Wellbeing Board into thinking about what's going on, challenging the subgroups about what there is, and trying to do some of that brainstorming about what can we do to integrate services around those priority areas. Because I think I've got everything about reporting and subgroups and dashboards. I don't think we've ever quite bagged off where the dashboard fits with the work of this Health and Wellbeing Board. That makes sense.
Come back, Josh, if you want to.
Yeah, I think it's spot on, Mike. I think at the moment it has been about getting the kind of revised plan in place, the strategy, getting that implemented. So as we're kind of moving into that phase 2 of the business as usual work, I think that's a key point for us to consider and look at how we're using that, because there is there's a wealth of information even within the outcomes report, and we're looking to expand that further beyond the fingertips data, because there may be other sources that we've not considered that the subgroups pull together. So yes, it's kind of, yeah, what do we do with that? How do we work as a board? Whether that's a kind of development session to really sort of hone in on kind of what we do with what we find.
Thank you. As you say, it's been a work in progress, and trying to change to allow everyone to fit together, but it's also giving the flexibility to the subgroups so that they take ownership of the work that's going on in that area. So thank you, Joshna. Anyone else? Yes.
I was just going to ask, this video that you're going to have to talk about the work of the Health and Wellbeing Board, will it be available in different languages? Because otherwise it's not going to be accessed by certain communities.
We will take that one forward. Louisa's Councillor Richardson's kindly volunteered to do the video for us, so yeah, we'll take that forward, and I think that's a really valid point.
I'm not sure I'll be doing it in all the languages there.
We'll train Councillor Richardson.
Okay, I can't see any more questions. So we're asked that the progress made by the Health and Wellbeing Board subgroups to deliver upon the priorities and commitments set out in the Joint Health and Wellbeing Strategy be noted, that the proposal to move to annual reporting of the performance indicators be approved, that the board notes that the work being undertaken to evolve the Health and Wellbeing Board. Are we all okay with that? Thank you. Item 9 concerns the Leicester, Leicestershire and Rutland Health and Wellbeing Partnership priorities, pages 113 to 116. This report provides us with an update on the newly established Health and Wellbeing Partnership and outlines the priorities agreed by the partnership at its meeting in August and October 2022. The report also provides an update on the development of the partnership's integrated care strategy, and the board will have an opportunity to formally comment on the draft strategy at its next meeting in February, and the report will be circulated after the meeting. Christine. Okay. Sarah Prima will present the report. Thank you.
Thank you, Chair. I'll take the paper as read, but there's just a couple of things I wanted to pull out, really. So just to remind members that the Health and Wellbeing Partnership is a joint committee between the local authorities, upper tier local authorities in Leicester, Leicestershire and Rutland, and the local NHS. And it was formed as part of the changes to the NHS that it came into effect in July of this year. So early doors, the partnership met and started to talk about, well, what would their priorities be, particularly bearing in mind that we didn't want to duplicate the health and wellbeing strategies, because all 3 local authorities had refreshed their health and wellbeing strategies, which has been really great actually in terms of the early development of all of our plans. And we really wanted to understand, well, how would the Health and Wellbeing Partnership add value into the system? And it was agreed that we would work on things that we could tackle at a system level and in partnership, and also where a system level discussion would add value to the work at place or elsewhere. So as Councillor Richardson has just said, we had a couple of workshops in June and October, and in paragraph 8 and paragraph 10 sets out the priorities that were identified at those 2 workshops, particularly around the cost of living crisis, access, so how do people access services, and the best use of our resources as public sector organisations, sometimes known as the anchor approach, and then health equity, integration of health and social care and prevention. So we have developed, there is a requirement for Health and Wellbeing Partnership to have a integrated care strategy to be published by December. We were really mindful of the really tight timescales around that. So the The version that will be circulated after the meeting and will be published once it's been approved by the Health and Wellbeing Partnership on the 15th of December is very clearly an initial draft for engagement. We're going to take 3 months or so in the early part of 23 to undertake that engagement and get feedback with a view of signing off and approving a final strategy by no later than the autumn of next year. It might be earlier, it will just depend on timelines, etc., as we go into the engagement session. I think that was all I wanted to say, actually. Thank you.
Thank you. Does anyone have any questions for Sarah? Mike?
Another one from me, sorry. Sorry, Sarah, just coming back to when we share the document, although there's a formal consultation period, you're not ruling out that if anybody's got any informal comments from Health and Wellbeing Board members to let you know?
No, so people can share any comments through involvement in meetings like this, or they can provide feedback to my strategy team. I'll make sure Matthew's got the email address for that.
Thank you, Sarah. Any further questions? No. So the Health and Wellbeing Board is asked to note the contents of the report, so we're all happy to do that. Yep. Item 10, the Health Watch Leicester and Leicestershire Annual Report 2021 to 22, pages 117 to 142, and Gemma Barrow and Harsha Katecha will present the report. Thank you.
Thank you, Chair. Well, our annual report highlights our key areas of work over the last year. So what we wanted to talk about is just some of the highlights of the activities that we undertook. So as you'll see in the report, we've published 10 reports about the improvements people would like to see to their local health and social care services, and we've been working to take the recommendations forward with the relevant providers. Every year we undertake a summer tour. Last year we attended over 36 events across the city and the county and had direct conversations with over 2,400 people. We then also conducted a survey and 350 people told us about the challenges accessing their GP practice. GP access has remained high on our agenda over the last year. During the lockdown period, we reviewed all the GP practice websites to look how informative and accessible they were for people. The findings we then shared with the CCGs at the time, and they were taken forward and consolidated within their research, again, to look at what improvements we can do for patients accessing those websites. When we were able to resume our interim review programme, we started to visit GP practices, based a lot on our research and that being high on our agenda. And we utilised the GP text messaging service, so we were able to reach more people than we could see on the day of the visits, because we were conscious that we couldn't talk to people at the surgeries necessarily because we were still in this hybrid lockdown period. And one of the practices we went to was Latham House Medical Practice in Melton, and we heard from over 1,000 people about their experiences of the practice. And we spoke to the team. The report was well received by the practice team. They welcomed our recommendations and the improvements, and they provided us with a detailed response, which we put in the report. Over this year, we have gathered an additional 1,000 survey responses from patients, and the key themes that we're looking at are waiting times, telephone lines, and access appointments with named GPs. We also did some work with carers, and we attended 14 carers group and heard from over 123 carers and staff and volunteers. We then also launched a series of monthly community focus groups to identify the impact of changes introduced across health and social care in response to the pandemic. So we work closely with our other Health Watch partners. This is just my nightmare, that is me. Sorry about that, it's going to be off. To look at influencing change. Bear with me 1 second, the page has gone wrong. One of the other key issues that we've had over the year is around dentistry, and we've shared our dentistry findings with BBC East Midlands. Harsha went onto the radio to speak about, onto the TV to speak about the issues we were facing. And throughout January 2022, we received an increase in the number of calls about dentistry. Now, we've been working very closely with the dental committee and community over the last year to look at improving dental services. All the evidence that we have on dentistry has been collected locally and then has been taken forward by Healthwatch England and the wider network. And over the last year, thousands of people have spoken about their struggles accessing NHS dentistry. And just this week, things are moving and changing based on that influence that Healthwatch has had to advocate as a network to making changes and making it easier for people to access clear and up-to-date information for accessing NHS dentistry. A couple of key projects we worked on was our male suicide project to look at the suicide prevention services that are there and the gaps in service provision. We did a lot of work, we did collaborating with the football club, local authorities, the brewery, to look at the suicide awareness and prevention amongst males. And we also worked in the community with Equality Action and Vitaminds on an initiative looking at young men turning the thoughts into a rap song to try and engage with people to help people speak out more about suicide prevention and raise it amongst a younger audience. And then our final project that we did last year was around homelessness, looking at experiences of hospital discharge and post-discharge care, because we wanted to explore what available support there was to homeless people when they were discharged from hospital. And it was an interesting piece of work. The report is now out because we could look at the difference between what staff providing the services told us and then what the homeless people who use their services had in that experience of hospital discharge. And we're still working on the recommendations within that report to make some tangible changes. And I will stop there because we'll talk about bits and bobs.
Thank you. Quite thorough report. Thank you. Anybody have any comments or questions? No? Oops, I'm on this page. So we're just asked to note that annual report. So thank you very much. Agenda item 11. The Leicester and Rutland Safeguarding Adult Board Annual Report for 2021 and 22 and the Business Plan for 22-23. James Fox, Safeguarding Partnership Manager, will present the report. Thank you.
Thank you, Chair. So you've had the report of the Safeguarding Adults Board for Leicester and Rutland for the last year, 2021 to 2022, and also you've got the outline of our current business plan for the current year, 2022-2023. We present this to the Health and Wellbeing Board so that the board is aware of some of the things that the learning that the Safeguarding Adults Board is finding from its audit assurance work and its review work, to highlight some of the findings from there, and also identify some of the areas that we've been identifying on a safeguarding basis that might be relevant for the Health and Wellbeing Board to note. I'm presenting this on, we're currently without an independent chair at the moment, the Safeguarding Adults Board. Our previous chair, Fran Pearson, finished a couple of months ago, and our new chair, Shona, starts in January. So we're kind of in the interim there, so that's why you've got me. Essentially what I was going to do was kind of pick out from the paper, outline some of the key messages relevant to the Leicestershire Health and Wellbeing Board, and then open it up for any questions or commentary. Essentially, the Safeguarding Adults Board's been working over the year. It's had a significant number of safeguarding adults reviews, and it carries out into cases, serious safeguarding cases, where adults have died or been seriously harmed, abuse or neglect is suspected, and we believe there's a learning. We believe that there's learning to be gained from around how organisations all work together. Technology is not liking me. Am I speaking too loud or something? And essentially the key messages, I think, from the work we've done, the assurance we've done during the year, and from those reviews particularly, is that we have partnership working has continued to work well. I think we reported that last time within COVID, and certainly I think Fran identified in her outline at her forward at the start of the report, actually the development and the strengthening in partnership working in safeguarding adults for the past few years within Leicester and Rutland, but also across with Leicester City as well. particular learning from the reviews around the need to improve the safeguarding of people with learning disabilities and autism. And actually what we've just recently done is made some more links with the Learning Disability and Autism Collaborative and some of their working groups, and ensuring that we're feeding in safeguarding adults reviews and learning into those groups and linking with their work plans there. A matter I think a recurring matter from our reviews is that around existing services and pathways don't appear to work well for people with multiple complex needs, particularly relating to mental health and substance misuse. And I think we're finding that where there are people with multiple complex needs, sometimes how services interact doesn't kind of help them to get the support they need from those services. We still need more work around the Mental Capacity Act and workers' understanding of applying the Mental Capacity Act. And I think we're done a lot of work around that, but I think there's kind of more to do there. And we're looking at other options of how we get that message out, really, of people making sure they're assessing people's mental capacity, the capacity to make decisions, and not, I guess, taking a blanket view on people's mental capacity, but looking at specific decisions there as well. And then the final thing we're looking to do is really develop our engagement approach, and it was to read the Healthwatch annual report that was on the agenda. We've made some links with Healthwatch. We've linked in closely with the City Have an Engagement subgroup for their Safeguarding Adults Board, and we're looking at how we can join up our resources, work together to hear more from people who may need safeguarding or may have been affected by safeguarding, to understand their experiences and ensure that's being pulled into our work as well. Those are the main areas from the annual report, and our current work in the business plan is outlined there as well, looking at how we address hidden harm, people who aren't necessarily being seen, and particularly thinking around learning disabilities and autism, as we've identified, and also how we're working together to support and sustain effective safeguarding in care homes as well. That's the summary of the report. Thank you.
Thank you. Does anyone have Christine?
Thank you, Chair. Yeah, this went to our scrutiny committee, adult scrutiny committee at the county, and Fran was very kind to come along and present it, even though she'd already stepped down. It was well accepted, and we went through it quite thoroughly. That is a good report, so thank you very much for bringing it.
Mike, thank you.
Yeah, thank you, and thanks, James. This might have cropped up at scrutiny, but James was looking on page 154 of the meeting pack, and there's that graph of kind of safeguarding adult reviews, referrals, and then commenced. You've got that blip, as you would expect, I guess, in 1920 and 2021 with the pandemic in terms of referrals, but the numbers commenced don't kind of add up. So basically, what kind of a backlog is there in terms of reviews that are needed but haven't been commenced yet, and what's the risk around that at the moment? If I've read it right, anyway. If I've got it wrong, then just tell me.
Yeah, if I explain that. So the referrals were the number of cases that were brought to our review group to say, we think this might need a safeguarding adults review. And the ones commenced are the ones where we've looked at the criteria and identified, yes, we are going to carry out a safeguarding adults review. So the difference is more about whether it met the criteria. And I think in a lot of those cases, we identified actually there wasn't any neglect or abuse that we could identify, or it wasn't something around how agencies have worked together, and so maybe an individual agency looked at that and reviewed that and found out. What we've been able to do with our processes is actually shorten them, and so we can identify the learning a lot more quickly. And maybe if I come closer, that feels like that's better, but I feel really booming. We identify the learning a lot more quickly. So in the past, we've had reviews that have been going on for quite a long time, whereas now certainly all of the reviews that started in the last couple of years will be, all the reviews that have started in the last couple of years will be finished by the end of this year, this financial year, by March. That includes ones that have started this year. So we've been able to address, I think, some of the backlogs through our processes. But yeah, essentially the gap there is ones that we identified didn't meet the criteria to carry out a review.
It's good to hear. Anything? No other questions? So we're asked to note that report, and thank you, James. Sorry you had the problem with the technology. Item 12. Our next item is Leicestershire and Rutland Safeguarding Children's Partnership Annual Report 21-22, and Jane Moore will present this. Thank you.
Good afternoon, everybody. So I'm presenting this report on behalf of the 3 statutory partners. So that's the local authority, the ICB and police. And the purpose of this is to present both the partnership report from last year and the business plan for this year that we're sitting in. And it's presented here today to highlight those safeguarding matters that are relevant to the work of the Health and Wellbeing Board. So if I just take you down to paragraph 12, in terms of the annual report, the purpose of that is to really give an overview of the work that's been done by the partnership and partners that's specifically around safeguarding children and young people across Leicestershire and Rutland over the previous year, but also looking at how effective those partnership arrangements have also been. In terms of the key messages from the report, we have reported that partnership working for safeguarding children across Leicestershire and Rutland has remained strong, despite the increasing pressures on children, families and organisations that work with those children and families. There's a specific concern around the availability of mental health beds for children and young people and the impact of this on safeguarding children with complex needs. And obviously this remains a concern for the partnership. The partnership has supported the development of the rollout of the ICON project, and that's about how we support parents to safely cope with their babies crying. The report sets out how partners are working with children who are affected by domestic abuse, and indeed how that could be improved, particularly by listening more and understanding the lived experience of those children. And also, we know that there's more work to do to better understand the impact of the work of the partnership, so to kind of share the impact of what's going on. And obviously the report also sets out how the 3 strategic partners will continue to take forward that work up to safeguard children. In terms of the business plan for 22-23, it sets out the specific actions that are the priorities of the 3 partners for this forthcoming year. And they're identified against a whole range of national and local drivers as well that we are concerned about or want to action. We've set out in paragraph 17 the priorities that have been agreed, and obviously we've attached the business plan to this. So the priorities for this year and next are around safeguarding babies, a focus on children's mental health and emotional well-being, safeguarding children from diverse backgrounds, understanding and acting on harm outside of the home, and also looking specifically at safeguarding independent and out-of-school settings as well. In terms of consultation, the annual report does include a summary of the consultation engagement work that the partnership carried out with children and young people and also with practitioners. And all of the Safeguarding Children's Partnership have also had the opportunity to contribute and comment on the annual report and the business plan as well. Thank you.
Thank you. Anybody have anything to add? No, so we're just asked to note the report again, and thanks for all the work, Jane. Move on to item 13, and this details several proposed matters in regard to the Health and Wellbeing Board's governance, namely changes to the integration executive terms of reference and the establishment of a new subgroup. Lisa Carter, Integration Service Manager, and Fiona Grant, Consultant within Public Health, will talk us through the report. Over to Lisa first, I think.
Hi, thank you all. So Yes, within the within the integration exec, which reports into the Health and Wellbeing Board, we've made some slight changes to the terms and conditions, the terms of reference for the integration exec. This is largely to bring in the work around the development and delivery of the joint health and wellbeing strategy that the integration exec is responsible for delivering BCF spend and co-commissioning against. So we've pulled together in the papers the terms of reference themselves. We've put together some of the information that you can see in that report around the changes around care coordination and community response, etc., etc. And I'll take them as read unless there are any questions.
I can't see any questions, Lisa. Thank you. We're going to Fiona now, is that right?
Thank you. This is really to propose a fourth subgroup of the Health and Wellbeing Board, which is focused around mental health. So currently mental health is a cross-cutting theme in health and wellbeing strategy into the state, which is a subgroup of the health and wellbeing people. An LLR wide working group across, so we can work more collaboratively. And one of the things that has become have a place-based mental health. So a place-based mental health subgroup that will due to the range of areas I think need and the importance felt that this and this on all aspects have the time and resource to address it as an area which is comparable with. And then the last few points I got is the role elements of the health and wellbeing, as well as other key require and the terms of reference are, and also the mental health group isn't about work that has already been quite effectively through. It's about providing opportunity to focus on those areas as well as providing that coordination.
Thank you, Deborah.
Thank you, Chair. I'm just querying where children and young people fit in for this. I see we were a rep on there, but a lot of our children have lower level anxiety, which I would call emotional health rather than mental health. So I think if we're going to set up a subgroup, it needs to cover mental health and emotional well-being rather than just mental health issues. And I think I'd like to see children a bit stronger in there. And also just looking at the membership, I see we're on there, children and families, but I think a really key part of this missing is schools, both primary and secondary schools, because they're the ones that are dealing with this lower level anxiety and emotional health with children and young people. So I think we need to include schools somewhere within those people that are joining this subgroup. Thank you, Chair.
Yeah, that's been noted, Deborah. And I think we're all aware of how much emotional health has on the very low areas of mental health right across the board. Mark, please.
Yeah, thank you. So yes, very supportive of the direction of travel. Just a couple of points just to mention. Whenever there's a group that just focuses on mental health and if we include emotional wellbeing as well, there's always a danger of that it misses those other things that are equally as important for mental health and emotional wellbeing. So the connectivity with other groups I think is really important as well, so we don't just pigeonhole, if you like, mental health into one group. That said, I do support the principles. And then the other sort of angle to this is just to make sure we do the cross-referencing to avoid any duplication, and because there are a significant number of mental health groups being developed in various locations, either neighbourhood, place, across the system, and we just need to keep one eye on making sure that we're not duplicating things and giving the purpose of the sort of the place-led group much more focus in that place. So I'm fully supportive. It's just the interrelationships with other things that affect people's mental health and making sure that we avoid duplication at all costs, please.
I think that's right across the board at the moment, Mark, with all the work going on. And I know that it will be feeding into the collaborative group from the ICB. Mike?
Yeah, it was the same point, and your comment, as Richard said, is kind of where I was at as well. I think there's a broader issue about how do the subgroups, some of which are kind of to do with ages, so children, young people's partnerships, the ICB and other subgroups staying healthy in this mental health group, which are a bit more kind of focused on topics or particular conditions, work together. And I don't really know if it's a question to Fiona in terms of how do we make certain that get to mental health and emotional well-being, which will be within the children, young people partnership, you know, that we don't get that duplication that Mark talked about. But you could ask any of the subgroups that same question, so question someone else, but I guess it's just thoughts on how we get that duplication.
Want to come back, Fiona?
Yeah, the intention was to sort of link on a regular basis with the other subgroups to make sure that there isn't duplication, because our intention would be to provide that coordination oversight, make sure we know where it is being delivered, but picking up any gaps in the agenda.
This is the part of the do sponsor watch, isn't it? You don't do everything, but you need to know that things are being done rather than being missed. Anybody else? No. So we're asked that the revised terms of reference, and we take on board your comments, Deborah, about education, etc. For the integration exec be approved, that the establishment of the new mental health subgroup of the Health and Wellbeing Board, the Leicestershire Mental Health Group, be approved, and that subject to that, the terms of reference for the Leicestershire Mental Health Group be approved. Are we all in agreement for that? Thank you. Our final report, excuse me, concerns the approval of the Leicestershire Better Care Fund Plan 2022-23 and the Leicestershire Pharmaceutical Needs Assessment, urgent action taken by the Chief Executive in between meetings of the board. On the basis that members were originally provided with the papers regarding the BCF and the PNA back in September, I propose that the report is taken as read. But we do have officers on hand if anyone has any questions. Are there any? No. I understand Lisa Carter has a quick update regarding the BCF, so over to you, Lisa.
Thank you very much, Chair. So on the 18th of November, you're probably aware that central government announced how we would be distributing the £500 million National Adult Social Care Discharge Fund. So I just wanted to update the Health and Wellbeing Board while we had this opportunity to. It's going to be mainly approved at each Health and Wellbeing Board level through the integration exec next week, because that's the nearest governance that we could use once we've decided how, as a system, we'll be spending that money. So for Leicestershire, the additional grant for the ASC proportion is just over 2 million, and we expect with the ICB share of that in the year be agreed to be roughly around 4.8 million. This will be distributed into lots, so you get 40% up front, and then the other 60% is based on the national BCF team receiving acceptable plans for the use of the fund. So there are a few regulations that the fund must contain. So it must ensure more people are discharged to suitable settings. That does include mental health discharges as well. It must prioritise approaches that are likely to free up the most amount of hospital beds. It can boost workforce capacity within adult social care. However, there's no guarantee. I mean, we know there will be future funding at the end of March 2023, but we don't know what that looks like yet. It has to be spent all in its entirety by March 2023. It has to be pulled into the BCF for each Health and Wellbeing Board area for LLR. The spend must be agreed across the system. Reporting will be fortnightly, but we don't know what that report will look like yet. It's likely to be much more based on outcome rather than spend. So, i.e., are you reducing the amount of delayed discharges? It cannot compensate for spend that's already been incurred, and adult social care will have to commit to making sure that their capacity tracker, which shows you how many beds are available across the county, must be updated as a minimum. It can't be used for admission avoidance. It has to be used for discharge planning, etc. So we have broadly put together some internal schemes that we would like to put forward, and we will hopefully at the next Health and Wellbeing Board give you an update of what that looks like. It was just a bit of a verbal background for you so that you know what that looks like for the next couple of weeks. We have to submit our plans by the 16th of December, and the first report will be on the 30th of December. I'm happy to take any questions, Chair. Thank you.
Thank you, Lisa. Mark?
Yeah, thank you. You mentioned mental health, and then you said you've got some plans that were being developed in the next week or two. So can I just assume that mental health is part of the plans that you're talking about, please?
Yeah. So we've got 3 or 4 schemes that we're looking at to improve mental health discharges, particularly from the Bradgate unit, which we know we have many detox for, well, a high level of detox for within the county. So that's quite timely, because it has been quite difficult for us to discharge people out of the Bradgate unit. So we'll be working hopefully with our partners across the system to work out how we can better discharge people with a varied amount of schemes. I think there's about 3 or 4 that we've got currently.
Thank you, that's helpful.
Christine?
Just make it clear to me that when you said you've got to get the report back for the 16th, but to be available from the 30th, who have you got to report back about how you're going to be spending the money or what you're going to be doing with it?
Yeah, so it's a bit like doing a mini BCF really in 2 weeks, which is quite alarming. So for the 16th of December, we have to report to the national BCF team pretty much in the same way that we do with a full year BCF. It has got the expenditure plan with it. There will have to be some narrative. We will have to kind of show how we've agreed that as a system with our ICB colleagues. The 30th of December is our first of the fortnightly reporting that we have to do. So its submission is 16th of December, the 30th is the first of our fortnightly reports.
Thank you. I misread heard the 30th. I thought it's
no, sorry.
Thanks a lot. Andy?
Yeah, thank you. I think more of a sort of statement than a question, really, but we've got an all-party winter board which oversees and coordinates all of the work that you've been describing. I'm just assuming I need to be just assured that the winter board will consider and approve these proposals before they're submitted.
The approval process is actually via each Health and Wellbeing Board area. So I think the plans are that we will approve the ICB spend elements of them. But to be honest, the ICB fund has to be split into each Health and Wellbeing Board area. But what we're looking to do is to approve the kind of overall spend for each Health and Wellbeing Board area. So you'll hopefully the Winter Board will see a plan that says this is what the city looks like, this is what county looks like, this is what Rutland looks like. These are the things within each of those that are being that are the schemes that are being delivered across the system. because we're going to have to apportion it.
Authorises its submission to the national team.
Sorry, say that again?
Can I just be clear who authorises the release of the plan to the national team on the 16th? Who says yes, send it?
I haven't got a clue, actually. It doesn't tell us in the report. Normally, it's through the chief exec of each of Health and Wellbeing Board area, utilising their special powers for agreement in the same way as BCF.
I'm not sure that's right, actually. Could we have that clarified, please? Because I wouldn't be happy for it to go in if it hasn't been cleared through the Winter Board.
We can clarify by all means, but I do think it's usually that way that the BCF is done. But I will get clarification back to you, Andy. Mark?
Yeah, I agree with Andy. With clarification would be good, but also the cross-referencing of the priorities of the Winter Board. Really, I think we're talking about the same thing anyway, but if we could align the proposals in the plan with what the winter plan is as well, that would just give some crossover between what we've collectively agreed as being the key issues to provide better patient care through winter. If the things in the plan that you're talking about are slightly different, we probably just need to talk through that just to make sure there's some why they're different or whether there's similarity or not. I think so. It's just there's a bit of a connection with the Winter Board that would be really helpful before anybody signs anything off.
Yeah, there are plans for it to go so that the Winter Board will be advised of what those plans look like for each Health and Wellbeing Board area.
So you will be advised. I think it's just the actual statutory thing comes back to us. Thank you. Any other questions? No? So we have been asked to note the urgent action taken by the Chief Exec using his delegated powers to approve the Leicestershire Better Care Fund Plan 22-23 for submission to the NHS England and to approve the final version of the Leicestershire Pharmaceutical Needs Assessment for publication. And that the Health and Wellbeing Board retrospectively approves the Leicestershire Better Care Fund Plan 22-23, including the planning template and narrative for submission to NHS England. Are we all in agreement? Thank you. Item 15 is dates of future meetings. So you have them there. The next one will be the 23rd of February 2023. As usual, all meetings will be held at 2 o'clock. And item 16, any other items which the Chairman decides to take as urgent, I have none. So that concludes the meeting. So can I wish you a happy Christmas, and that concludes the meeting now. Thanks for attending.